In Fox 5 Health News, many women are reportedly turning to new weight loss drugs to shed pounds before getting pregnant, but experts are concerned about possible links to birth defects and other risks.
All right, joining us now, Dr. Serge Sugger from Holy Name Medical Center. Doctor, thanks for joining us. And obviously, we know obesity continues to be a huge problem. It could make it more difficult to get pregnant. Presumably, that's why we're seeing an increase in these drugs being used, right?
Exactly. So, hi, Steve, Natasha. Thanks for having me. You're absolutely right. We know when we look at obesity, it has several factors that affect pregnancy. One is just the idea of being fertile and getting pregnant, but also maintaining a healthy pregnancy is associated with adverse outcomes, sometimes miscarriages, increased rates of stillbirth, et cetera. So it's not surprising with these new drugs, Ozempic, Wegovy, Mounjaro, et cetera, that people are interested in utilizing these medications to ensure they have the healthiest pregnancy they can. Now, the issue is when we do randomized clinical trials and these drugs are all very new, pregnant female were excluded in the study. So we have no long-term data in terms of how these drugs affect the fetus. And that's really important for people to understand. Yes, there's a narrow window where you could use the medication, you could lose weight, oftentimes very quickly, but physicians oftentimes recommend within 2 months of trying to become pregnant, you should stop the medications. The reason being is because you want to make sure that drug is out of the system before conception. The idea, and this is where it gets tricky, is people need to understand that A, we oftentimes don't know when someone might become pregnant. These drugs can also affect birth control. So someone may be taking this medication and birth control and become pregnant and not necessarily realize they become pregnant. So you can see that how this can, while there has a potential, a good effect in losing weight, in keeping weight down, increasing fertility, also decreasing blood sugars. Remember, diabetes in pregnancy is also associated with adverse effects. Really, we need to see more long-term studies. There are no studies in humans. That's what we call post-marketing. We follow pregnant women going forward, and we can get a better idea. Animal studies do suggest there could be a potential, and I caution, a potential effect on the fetus, but really the bottom line is more information needs to be known. If a pregnant woman is going to use this prior to conceiving, they should talk to their physician for more advice.
Yeah, that makes sense. Let's talk about another study that we're monitoring too. It finds that drinking just 1 can of diet soda every day may boost your risk of a dangerous heart condition linked to stroke. I feel like people hear diet and they think that it's healthy, but I mean, there's a bit of misconceptions there. So talk about what the study found.
Sure. So this is the first study that has shown an increased risk of something called AFib for short, or atrial fibrillation. Think a quivering or a quick movement of the heart. And they saw that those that take artificial sweeteners, which, like you mentioned, people oftentimes wrongly so think that this is no big deal, or maybe safer than normal sweetened drinks, saw a 20% increase in AFib. If you looked at added sugar drinks, 10%. Now, those that drank drinks that had no added sugar, think orange juice, fresh pressed juice, there's actually a reduced risk in AFib. Now, why is this important? AFib, or this fibrillation of the heart, this alteration heart mechanism, is associated with a whole host of adverse effects. It can increase your risk for a heart attack. It's the #1 risk factor for increasing strokes, and strokes associated with AFib are oftentimes much worse than strokes that are caused by other mechanisms. It can be linked to dementia. It can be linked to renal failure or kidney disease. And if we look at the incidence of AFib in the United States, it's already increasing probably because of the older age of our population. Obesity is associated with tobacco use and alcohol. So I think people really need to understand that this is the first time that this has been adequately or has been shown to be an increase in the rates of AFib. The reasons why still need to be teased out, but when they control for all other variables, smoking, high blood pressure, diabetes, obesity, they still saw this signal of increased risk. So I think anyone who's drinking soda, and again, this study looked at those who drink more than 2 liters of soda a week. That comes down to 1 medium-sized Coke at your local fast food chain, not that much. I think people should really reconsider and look at other options.
Yeah, that's what sticks out for sure. It's not a massive amount of soda you have to drink to have that issue. All right, Dr. Sugger, we appreciate it. Thanks so much.
Thanks, guys.